Hey guys, so in this video I'm going to be showing you how to work tibial internal and external rotation or knee rotation at the knee joint. And this video is going to be specifically for helping you maintain better knee health. Now, the reason why we're working on knee internal and external rotation because it's a motion that a lot of people don't know the knee is capable of. The knee is very familiar for flexion extension, but little do people know that this rotation is actually what allows the knee joint to maintain the health of the connective tissue inside the actual joint capsule. All that means is if you want to keep your menisci safe, if you want to keep the ligaments inside your knee safe, having this capacity to rotate is going to be key for long-term health of that joint. Now let's get to the actual exercise. Now for tibial internal and external rotation, we're going to want to focus on the muscles that are actually responsible for creating the motion. Now we're going to start by getting into seated position. I'm going to start with the right leg. So you can keep your right leg in front or right heel in front of you. Your left foot is going to go under your right knee. And all you're going to do is take your fingertips, put them behind your thigh or behind the knee joint. And the reason is the muscle that we're going to start with what's called tibial external rotation or knee external rotation. And the muscle that's responsible for creating this external rotation is actually, I'm going to turn around so you can see, this lateral hamstring. So you can see the contraction here along the outside of that hamstring. And so you're going to try and look for that in your own leg. So you're on the ground, seated on your butt, right foot's in front, left foot's under your right knee. You're going to take your fingertips, put them behind your thigh, and from here, I actually want you to relax the ankle. Don't move the ankle, don't put tension through it because it's going to be something that you're going to want to try and compensate. So let that relax, fingertips go behind the thigh, and slowly think about taking your pinky toe and rotating it or moving it to the right, away from the midline. And if you do this right, you should see your shin rotate away from the midline as well. And you should look for a contraction on that outside of that hamstring. If you don't, think about trying a little bit harder and see if you can find something moving. If not, go back and forth with that foot and you should feel some motion under that leg or under that thigh. Once you feel that, you're going to try and isolate that. And we're going to hold this for a 10-second count. You're going to take a big breath in. On the exhale, hold, push, push, push. Try and contract that a little bit harder. We're going for 8, 7, 6, 5, ramp up that effort. 4, if you got anything left. 3, 2, 1, and now you're going to relax. Now for tibial internal rotation, this one's a little bit tougher. What you're going to want to do is you're going to think about taking your big toe and rotating it in towards the midline. Now you might notice some muscles actually on the inside of your leg contract to create this motion. Now from here, you're going to take a big breath in. On the exhale, bring that toe onto the inside or towards midline. You're going to hold for 8, 7, 6, 5. You're taking your big toe. You're really bringing it in for 3, 2, 1, and relax. So you should have felt some of that contraction now on the medial or on the inside of that hamstring. So just to review, tibial or knee external rotation, you're going to look for that contraction on the outside of that hamstring. Knee internal rotation, you're going to look for a contraction on the inside of that hamstring. And a good visual cue for you for tibial external or knee external rotation, your pinky is going to go away from the midline. For knee internal rotation, your big toe is going to go in towards midline. So let's go back to the left side now. All you got to do is switch legs. Right leg is under your left knee. Left foot is just right in front of you. I like to keep a nice 90-degree angle just to be comfortable. Hands go behind the thigh. We're going to take a big breath in. On the exhale, pinky comes out, and we're trying to look for that contraction on that outside of that hamstring. We're going to hold 8, 7, 6. Ramp it up if you got anything left. 5, 4, 3, 2, 1, and slowly relax. Take a big breath in. Exhale. Big toe comes in, and hold. See if you can get that contraction on the inside of that hamstring. You can even think about digging that heel in a little bit towards you. That's gonna help you contract. 5, 4, 3, 2, 1, and relax. Good. So that was axial rotations for the knee joint. We're gonna move on to what's called hinges. So now we understand how to create tibial rotation through the knee joint. Now we're gonna work what's called a hinge. So if you think about a door hinge, it just opens, closes, except this time for the knee joint, we're gonna bias that rotation. So from here, you're gonna lean back a little bit, you're gonna actually interlace your fingers, pick up that leg a little bit, you're gonna rotate that tibia, you're gonna go into knee external rotation, and we're gonna work 10 repetitions here. We're gonna hold this, we're gonna come up, extend a little bit, and then curl back down. That's 1, up, down. That's 2, up, 3, 4. Really focus on that pinky toe coming out to the side. 5, we got 5 more. 6, 7, you should feel a nice little burn. 8, almost inside the joint. 9, 1 more. Rotate. 10. Oof. Let's switch. You will get some ankle stuff involved on that one, that's okay. As long as you focus on that rotation happening at the knee joint from that outside of the hamstring. So over here, picking the leg up a little bit. We're focusing on rotating out, so we're looking for that outside hamstring. And here we go, 10 reps. 1, up, down. 2, 3, 4, 5. Back and forth. 6, focus on that knee staying rotated. 7, 8, drive that pinky out. 9, as if you're trying to show the arch of your foot to the ceiling. And 10. Nice job. So what I recommend is you replay this video. If you had trouble focusing or getting that tibial rotation or that knee rotation, stick to just the first half of this video and get really good at this. I promise you, if you get good at this, this will save your knees. It's something that a lot of people don't train. It's something that you're gonna wanna get really familiar with in order to maintain long-term health of that knee joint. And then once you get really good at that, come back to this video, work those hinges. You can replay this a couple of times. This is especially useful if you're traveling a lot, especially if you're seated a lot. Creating this rotation is going to bring nice, good motion into those tissues deep at the knee joint and just keep them healthy and moving well. So I'll see you guys next time. Peace.